Hepatitis C is a viral infection of the hepatocyte cells of the liver. It is an acquired disease in humans, and it is acquired by either a blood transfusion or sexual activity. This blood transfusion concept also includes sharing needles, which would be blood to blood with an introduction of a dirty needle. Hepatitis C is a chronic infection of the liver cells. Many people have it for a number of years before they have any symptoms. What it causes is inflammation of the hepatocytes, and this inflammation can cause cirrhosis of the liver. Patients with hepatitis C can develop not only a fatty liver, a more serious condition of cirrhosis of the liver, and the most serious condition of the liver, which would be hepatocellular carcinoma. The patients who have chronic infection of the liver with hepatitis C virus can develop a chronic inflammation, then develop cirrhosis, which can cause tiredness, can cause jaundice, can cause the liver not to function properly, can't excrete the normal biles or things that need to be cleaned from the blood by the liver to be taken out of the system. This can cause the liver to be very ill, not function, and cause secondary things such as tiredness, cirrhosis, causing jaundice, ascites, which would be buildup of fluid in the body. Your blood system to the liver and away from the liver does not work well. There's many changes in the body that occur. They don't occur usually immediately. It's usually a very long-term disease that slowly makes the liver sicker and sicker, more fibrotic. It loses its ability to function properly. This disease is very worldwide spread. There are millions of people in the United States of America who have this disease chronically and who have developed cirrhosis and hepatocellular carcinoma. The rate of development of a cancer of the liver once you have cirrhosis of the liver from hepatitis C is 20-fold more than the average person. For every year that anybody has any kind of cirrhosis, there's a 1 to 4% increase every year annually of developing a cancer of the liver. It is very important to know whether you have hepatitis C or not only because you might want to get treatment, but also because you have to understand that your chances of developing cirrhosis are very strong, and the chances then become much higher than the average person of developing a hepatocellular carcinoma, which is a liver cancer. The disease, as I said, is international. It's everywhere in the world. And again, it is transmitted from person to person to sexual activity, or it can also be transmitted to blood products such as transfusions or using dirty needles. And it's also been related to being used with, at one time, dirty needles from tattoos or the ink pots that are used in tattooing.